Deus in Sion, nomini Domini, Deus in Sion.
From a physical perspective, Kundalini is an energetic-based consciousness that is located at the base of the spine in the last 3 vertebrae of the tailbone. Okay? That's where it's stored on every person that has a spine. As it unwinds itself through the tailbone and begins to express through the spine, conscious volitional control is not advised. Especially from a therapeutic standpoint, you will not be able to control the expression of the Kundalini on the patient. What you will be able to do is help the patient modulate their response to the many phenomena that occur by helping them to surrender and to understand that it's okay, this is natural, the body is wired to have this. This is a natural part of the body. Body knows what it's doing. It doesn't need the ego of the person or the kind-hearted therapist to try to modulate, which is what happens a lot. You know, the therapist wants to help, you know, and so they'll do anything they can do to try to help that person not feel pain. Pain is the big thing we want to take, you know, release people from. And with Kundalini, sometimes they need to feel that pain. Pain is a necessary source of the transformation. Okay. Pain is not always something we need to run away from. Pain is sometimes a thing that we need to embrace. Yeah, question? Yeah.
It's kind of half gone now, but it was something about, does Kundalini mimic symptoms? I mean, if you're a therapist or even a person and somebody presents with something or I present with something, how do I know that it's Kundalini? Like, how would you describe the difference, say, with your back? How would I know that we say I have pressure and pain in my sacrum, that's Kundalini
History,
and not?
You know, the intake history of the person is very, very important. If the therapist has some education with regards to Kundalini, then the therapist will know that there are certain signposts beyond, you know, the black and big toe that indicate Kundalini expression within the individual. And once that occurs, because of its power, because of the power it has to transform the individual, the therapist can then begin to diversify their diagnostics. Okay, does this correspond with Hashimoto's disease, or does this correspond with a thyroid that is being infused by the Kundalini? And what historical reference do we have for the thyroid with the Kundalini, and what historical reference do we have for Hashimoto's? And then you look at the results that you're getting from your testing, and the unawakened therapist can come to a very definitive decision about what is affecting that patient, whether it be of a Kundalini or of another nature. Does it mimic? Yeah, there can be similar symptoms. With Kundalini, however, within certain expressive states of the experience, there is nothing that can, I mean, the closest you'll come is bipolar schizophrenia, which is typically how it's diagnosed right now. Person will see entities, floating lights, hear their name called. A person will experience forms of energetic interaction that are not accepted by science at this time, and so therefore science will relegate it to a catch-all DX or diagnosis of schizophrenia, bipolarism, and many other psychological states that they control through pharmaceutical drug therapies. Yes, sir.
How can we help people who are experiencing these symptoms but know nothing of the Kundalini, and we know that you know, even the bringing up the word might scare them off due to religious beliefs or just, you know, the lack of scientific evidence backing it. So how can we help people that are coming forward with these things?
Within the context of a religious belief system, it becomes easier, really, because Kundalini fully subscribes to all the different religious belief systems. It does have devotionalism as an expressive symptom. From the Christian to the Islam to the Buddhist to the shamanic, and throughout humanity, the Kundalini is present within the belief systems, either through symbol or through the action of the natural environment. So, you know, helping a person through the context of their specific religious belief system would be one of the best first steps you could do. Okay, you could do for that person. And then, you know, backing that up with your own authentic experience or written material that we have available now about the Kundalini experience and the classical symptoms that are associated with it. I have students come to me all the time. Oh, Chrism, my tailbone is wagging, my left big toe is hurt, turning black, or my heart is just racing and I can't stop it and they can't find any kind of a problem, or, you know, I'm seeing floating lights, I'm hearing my name called, I'm hearing a hum, I'm hearing the sound of a waterfall, I'm seeing entities that walk through walls, you know, all kinds of different things that happen for a person. You can explain to them that it's, first of all, it's okay, and you don't need to be afraid. Okay, that if this is Kundalini, then it is absolutely natural. It is something that the body is wired to have. It is, in essence, it is a tremendous gift, and you can begin to help them manifest changes within their response to society that allow Kundalini to exist and for them to exist within society at the same time. Questions? Yes, sir.
How about from a professional context, like say a doctor who, you know, who could lose his practice, or if he comes out and he tells the wrong patient that they have Kundalini, and yeah.
Well, any kind of a person that is professionally attached to a specific expressive education and the Kundalini, they're just going to have to keep quiet about it. And a lot of them do. A lot of, you know, there are MDs that have the Kundalini, they just don't have the term, but they have the skills. You know, they can look at a person, they can get a feel of what's wrong with that person. Like any therapist that has really expanded beyond the physical and accepted continuum of expression, they can reach into a patient's physiologics or immunofunction or whatever the issue is, and begin to allow the Kundalini that is unnamed within them. You know, they had all the spinal sweeps, they had all of that stuff, but they didn't have a term for it. They knew that if they talked about it, they'd get fired or, you know, in some way alienated from their profession. They like their profession, and so they use it within the context of that profession. Any of the therapists, from counselors to PhDs to whatever the expression is or the profession is, a person can have Kundalini and be successful, be exceedingly successful in their patient practice.
So, who naturally experiences this without going through some course? And when does it start to
Okay, now you're going to get into areas that are going to challenge accepted scientific understanding of what life and death consist of. In many of the ancient cultures, the idea of reincarnation is a fact, not a fiction. It is not something to guess about. In the United States and the Western technological societies, this is not even something that comes up for discussion. Okay. So if you were trained within the Western United States ideologies within this, you know, you may find some of this challenging. The idea is to come closer and closer and closer to the divine expression within a human body. A human body will take life after life after life after life for the purpose of education, and the reason that education exists is for refinement, to become closer and closer and closer to the Godhead. Okay. When a person reaches a certain point of refinement, naturally, the Kundalini will come up within them, as it did me. I didn't do any special practices for this. Okay. It came. As that occurs, the person will either live with it or die with it. First time is very difficult with the Kundalini. You know, there's 30% ratios. You know, 30% will commit suicide because it doesn't fit with any of their preconceived attachments and ideas of what life is to be about. And they're not able to make that change. It's just too far outside of their understanding of what life should be. Another 30% will go to healthcare practitioners, and in our society receive drug therapy for a large portion of their life. Heavy trains, the heaviest trains for Kundalini.
These are people who are refined?
Yeah.
Wow.
Yeah, you bet. They're refined, but their ego consciousness just cannot have this. It is just not within their context of understanding the world. And so they willingly self-admit to the psych ward. Many people in the psych ward basically have Kundalini. Okay. Well, you know, I mean, think about it. When you can see Aunt Amy come to you through a wall or stick her head through the ceiling and say, "Hi," you're going to be thinking you got a problem. You're not going to tell that to your MD because the Thorazine's going to come out. Okay. You're not going to tell it to your friend because they just think you're nuts. You're not going to tell it to your employer. So you just want it to stop. Aunt Amy, you're dead. Stay up there. Don't talk with me. I've got a life to live. So they go, and I have people, this is one way for them to deal with it first time off. The other 30% will actively seek this out and want it. And because of their refinement status, they can get it. They have it. They get it. They mature with it. They work with it. It works with them. And they become that much closer to the evolutionary goal of the human being, which is to become closer within a physical expression to the Godhead, to the divine self.
So just because we're here inviting it doesn't mean that we will experience it. Is that
Right. Although you're here listening and you're inside a field of radiance right now. So that's doing something to you.
Deus in